Today I am with Dr. Arijit Dutta Chowdhury. Dr. Arijit Dutta Chowdhury is a renowned psychiatrist practicing more than 20 years in Kolkata. Good evening, sir. First of all, I would like to know what is bipolar disorder and what is the symptom of bipolar disorder.
Bipolar disorder is a type of mood disorder. Usually, all of us are very well aware of depression. Depression is the talk of the town these days. So everyone knows depression, what it is. Now, bipolar is just a variant of this when the patients is having episodes of depression along with episodes of mania or hypomania, which is just opposite of depression. Like in depression, we have low mood, we have lack of appetite, lack of sleep. Then many patients, they have lack of energy, they have low self-confidence. In severe states, they can have suicidal ideas, death wishes. And in manic or hypomanic episodes, it's just opposite. The person feels energetic, the person feels very enthusiastic, he might talk excessively. Sleep is again disrupted, but the reason is different. Here, the person is so much active, so much energetic that he cannot sleep. Then many times they have increased appetite, they have increased more power, and they think of big things like what they can't do. They think of that, like they have inflated self-esteem. Some of them have delusions of having great power or being someone like a great personality or having a lot of money, being very rich. All these things. So this is just opposite what we know of depression. So bipolar, the term comes of like two poles of the same illness. Normal mood is, if you say the normal mood is a straight line, then depression is when the line goes down, and mania or hypomania when the line goes up. So some patients may have only depression, so they are not bipolar. They are suffering from depressive disorder. But when a person is having both the poles, like down the average line and then up the average line, then we call them bipolar. Okay.
In some schizophrenic patient, we find this type of mania, hypomania, and depressive disorder. So, how people will find that realize that they have only bipolar disorder,
No, no,
not
no.
any schizophrenia?
Schizophrenia is different. Schizophrenia is not a disorder of mood. Bipolar is different. Schizophrenia is a kind of psychotic disorder when the person contact with the reality and judgment gets impaired. So it is characterized by delusions, and the delusions are not like usually it is like delusion of having a fear of getting persecuted by someone, or that they think that people are conspiring against them. They may have hallucinations like the voices they can hear which is not there, or they can see someone who is not there, which is called, this is completely different. The up and down of mood, either feeling very happy or feeling very sad, that is not there in schizophrenia. Schizophrenia is more like it's a different world. They have their own world, which is completely different from our world. So you cannot relate. Like a bipolar patient, you can relate with the person. Like you can understand that he is very happy or he is very sad. But patients with schizophrenia, you cannot relate with them because they're in a different world of their own. So it is a completely different disorder. Don't confuse it with bipolar. Okay.
What cause bipolar disorder, and is that anyhow linked to genetic problem, or it can happen to anyone?
Actually, psychiatry, the causes for psychiatric illness are always multifaceted. Like we cannot singly like in a physical disorder like malaria, you can say that there is a particular organism causing it. Tuberculosis, you can pinpoint an organism. Psychiatry is not like that. It is mostly multifaceted. We call it biopsychosocial model. Like there are some biological underpinnings, some psychological underpinnings, and some social underpinnings. So bipolar is like same. There are biological disturbances in bipolar disorder, like mood disorders. There is a this neurotransmitter called serotonin, and another is norepinephrine. So many times we see these levels of this serotonin, norepinephrine, they are not in the usual range. So that is a cause. Then there are genetic causes like bipolar disorder runs in families. So there are family studies, there are twin studies, association studies which show that bipolarity occurs more frequently in a family when there are other patients of bipolar disorder, like the parents or grandparents of bipolar disorder. So there is a genetic cause as well. Then comes, this social cause, like there are societies when there are minorities, oppression, all these things, they at times may cause severe depression. And many psychologists they have said that this hypomania mania is actually a reaction to depression. Like a person is depressed for a long time, then his psyche actually tries to do the opposite. So from oppressed depression at times this manic or hypomanic phases come. So that is another psychological theory. And so it's
And
very difficult at this point to point out one single cause, but it's mostly these causes, like mostly now the current research is mostly on biological causes because we have found many these biological markers, but we cannot also forget the psychological and social causes. Like in social causes, also get the parenting, the household, like abusive parents, addictive parents, their children, they see this violence and deviant lifestyles from very beginning, so they may get depressed. And whenever a person is having depression, then there is a chance that that person may remain only having depressive episodes, or he may have the other pole also. So these are the usual causes which are can be I can tell you in a very little time, because otherwise it's a very big thing and very technical also. So this is in gist for the common general understanding. Okay.
when someone needs medical attention, and how they will know that they are having bipolar disorder.
See, what usually happens is the depressive phase. When the depressive phase happens, the person can understand that no, I'm depression, I am not feeling
Uh,
well. So at that phase, people come to the psychiatrist on their own. But the other phase, as I said, mania, hypomania, that phase, as the patient is very euphoric, the patient is feeling very good. That phase, the patient doesn't want to come. Then it's the relatives, है the relatives who bring them to the psychiatrist because they lose the insight. Insight means the feeling that I have some problem that is completely lost. They are very happy. The patient who is in manic or hypomanic phase, they don't want to come to normal. They want to remain in that state only because it is very happy phase for the patient. So that time the relatives, the family members, they usually bring to us.
okay, and any other psychological disorder can be found in this type of patient usually.
Yes, there are. Yes, usually in bipolar disorder, when the active manic phase, we cannot see the other things, like because when that manic or hypomanic phase, it takes the whole attention. It is so dramatic. It is so different. At that time, we don't see many other psychological disorders. But when the patient settles down, when we treat them, when the mood becomes normal, then we see other coexisting disorders like anxiety disorders. Or we can see coexist bipolar like anxiety disorders like obsessive compulsive disorder, generalized anxiety disorder. So this kind of anxiety disorders we see coexisting. Then this addiction like alcohol addiction, cannabis addiction. Addictions are also quite common in bipolar disorder. Then a good amount of bipolar disorder patients also have personality disorders, like their personality is deviated from the normal from the beginning, even before the bipolar disorder started. So these are the common disorders which can coexist.
Thank you. Thank you for watching this video, and thank you, Dr. Arijit Dutta Chowdhury, for giving us his valuable time. Hope our viewer have some idea about bipolar disorder. And if you have any question from Dr. Arijit Dutta Chowdhury, then in our description section, we have mentioned his chamber address and phone number and appointment number also. You can contact directly Dr. Arijit Dutta Chowdhury if you have any question on bipolar disorder. Dr. Chowdhury regularly available in Medica Superspecialty Hospital, as well as he is also available Kalikapur at South Kolkata and Shyambazar in North Kolkata.